Obsessive Compulsive Disorder is often misunderstood in modern society. The letters OCD have become synonymous with people favouring organisation, planning and regular hygiene. We've all heard the terms, "I'm a little OCD as I like to keep my room clean." Stop, it's likely you don't suffer from OCD. OCD itself is a debilitating condition that impacts the work, education and social lives of those affected. If you want to learn more, keep watching as we'll break down OCD in this video. So let's talk mental health. I'm Dr. Hart Pinto, and in this series we aim to break down the social barriers of mental health. At JHP Medical, we make weekly information videos designed to increase awareness and help you better understand your medical condition. So, if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. Okay, so what is OCD? OCD, or Obsessive Compulsive Disorder, is an anxiety disorder characterised by obsessive thoughts and compulsive behaviours. OCD can be distressing for those affected and has a significant impact on an individual's daily life. Why OCD occurs is not fully understood. However, it's thought to be associated with low levels of the neurotransmitter serotonin. Research has also pointed to abnormal brain activity in the basal ganglia and the frontal cortex. The condition is relatively common, affecting up to 3% of the population, with symptoms presenting in early adulthood and the majority receiving their OCD diagnosis in their 20s. A genetic link is likely to further influence the development of OCD, therefore individuals with an affected parent or sibling are at higher risk of developing the condition. OCD sufferers can also suffer from other mental health conditions, such as depression or even schizophrenia. So what do OCD patients experience? The symptoms of OCD can be broken down into 3 components and should be considered as a cycle. First comes obsessions. These are unwanted and often unpleasant, intrusive, repetitive and persisting thoughts that cannot be shaken off. Some of the common themes are the fear of deliberately harming yourself or others, either intentionally or accidentally, fear of contamination, a need for symmetry or orderliness, and some individuals may experience violent or sexual thoughts that can even be repulsive and distressing for the patient. Next comes emotions. The obsessions discussed may cause significant distress to individuals and can affect a person's function in daily life. These thoughts increase anxiety, which in turn drive the compulsion coping mechanism. Next is compulsions. These may be ritualistic behaviours or mental behaviours individuals perform to relieve their anxiety. Sufferers often recognise that this behaviour is irrational, but they feel compelled to complete the ritual. They experience mounting tension, which is immediately relieved on completion of their compulsion. Some examples include repeated hand washing to remove the contamination, checking doors are locked, counting, and hoarding. Unfortunately, the obsessive thoughts can soon reoccur, resulting in a repeat of the cycle. So how can OCD be diagnosed? If you are concerned that you or a loved one is suffering from OCD, you should discuss your concerns with your regular doctor. Your doctor can only make a diagnosis of OCD whether obsessions and compulsions are present on most days for a period of 2 weeks, and there is an observable impact on daily activities or significant distress caused. So how do we treat OCD? The symptoms of OCD are unlikely to improve on their own, but with the right treatment, you're able to regain control of them. Treatments for OCD can be separated into 2 parts: psychotherapies and medications. So let's take a look. Psychotherapies for OCD are usually centered on cognitive behavior therapy, CBT for short. In CBT, you will work closely with your therapist on exposure and response prevention. Here, your therapist will break down your problems into thoughts, feelings, and actions, and you'll be encouraged to face your obsessive thoughts and not neutralize them with a compulsive action. This may be difficult at first, but should improve over time. Most people will experience an improvement or even resolution of their OCD symptoms with CBT. How long this can take will vary. If you have particularly challenging OCD symptoms, you may need a longer course of treatment. If CBT hasn't worked for you, or your symptoms are particularly challenging, your doctor may recommend a trial of medication. First line are SSRIs. These medications work by increasing the level of serotonin in your brain, helping balance the brain's natural biochemistry. It can take some time to notice the difference in your OCD when taking these medications, so expect to have an initial trial of 12 weeks. So on your part, some perseverance is necessary. For the minority of patients, their symptoms of OCD remain uncontrolled with combination therapy of psychotherapy and SSRI medication. Amongst these individuals, an onward referral to a psychiatrist may be helpful. Your psychiatrist may consider a trial of antipsychotics or even other therapeutic methods available. Up to 80% of individuals will experience an improvement in their OCD symptoms with a combination of medication and psychotherapy. However, for some, symptoms are resistant and can worsen over time. Occasionally, the symptoms of OCD can become so challenging that people may consider harming themselves or taking their own life. If you are having thoughts of harming yourself, it's important to tell someone. Speak with your doctor, someone you can trust, or even a helpline. I will include a contact number for the Samaritans in the description below. I hope you've enjoyed this video as much as we have making it. Don't forget to subscribe and interact with us by giving us a thumbs up or leaving a comment down below. By doing this, you help support the growth of our channel and our mission to help educate as many people about their medical conditions as possible, and hopefully improve their quality of life. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis, or treatment. Please don't ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, call your doctor or ambulance service. Thanks for watching. See you next time.